Welcome to the American Academy of Clinical Health Psychology webinar, Clinical Health Psychology Certification, Process and Preparation. Hi, I'm Mark Vogel, and I'm joined today by my colleagues Lisa Kearney and Christina Shook. Each presenter today will describe different aspects of the board certification process. We're glad you've joined us today. Let's jump right in. Our objectives today: we intend to look at the steps of board certification in clinical health psychology. And this webinar will be very specific to clinical health, but we will also describe some of the generic requirements. We will then turn our attention to how to prepare your materials for board certification. And finally, we will share helpful tips to successfully navigate the board certification process. The specialty, as defined, serves as the basis for the examination, including the practice sample, submission, and review, and the oral examination. Familiarize yourself with this definition and the associated elements. These elements include the promotion of health, treatment and rehabilitation of illness and disability, and systems-level improvements within healthcare. The specialty definition is further elaborated through the competency characteristics of the specialty, which also serves as the basis of the evaluation of the candidate's performance during the oral examination. A description of these competencies can be found in the Clinical Health Psychology ABEP manual. There are three phases associated with the board certification process. These will include the initial application review to establish candidacy, the practice sample, and then finally the oral examination. The relevant material, including the candidate manual, can be found at www.abpp.org, and you can download and get more details about each of the steps. Now, in our webinar, we're going to examine each of these steps in a little bit more detail. Like Dorothy, you may be hoping that your fairy godmother was able to grant you your wish and that all this would be completed. But that's not exactly how it happens. The first step of the process is the credentials verification. First, the application is reviewed by the American Board of Professional Psychology's central office to verify doctoral degree, the licensure, and professional standings, and the absence of any disciplinary actions. Second, the application is forwarded to the American Board of Clinical Health Psychology for their credentials review as it relates to the specialty board. I know this is a busy slide, but the doctoral degree requirements can be broken down into the applicant needing a doctoral degree in professional psychology, which is accredited by APA, CPA, or listed in the ASPPB publication, Doctoral Programs Meeting Designation Criteria. Now, this later option is particularly applicable to degrees awarded outside the US or in Canada. Now, if this first requirement is not met, the doctoral degree can be met if the applicant maybe holds a CPQ, which is a Certificate of Professional Qualifications in Psychology, which is issued by ASPPB. Likewise, the applicant could be credentialed as a health service provider by the National Register of Health Service Providers in Psychology, or the Canadian equivalent, or the applicant could hold a doctoral degree in psychology and subsequently been certified as completing the requirements in a respecialization program, or the applicant qualifies for an individualized exemption review. We won't go into detail about these different exemptions that are available through ABEP, other than to say that they are available if someone does not meet the initial requirements as listed in bullet point number 1. If the doctoral degree was granted in 2018 or later from the US or Canada, it must be APA or CPA accredited or accredited agency recognized by the U.S. Department of Education at the time of the applicant's graduation. Now, there's also a document called the ACHP Generic Doctoral Program Eligibility Requirements, and you can find this on the ACHP website. Doctoral programs are expected to meet these requirements, and programs that are APA or CPA accredited typically have met these requirements. Finally, all the ACHP candidates in the US or Canada must be licensed as a psychologist for independent practice at the doctoral level. In addition to the generic foundation requirements delineated above, clinical health psychology has specialty-specific requirements. And in terms of internship, there is a requirement for training programs in professional psychology where the internship is APA accredited or APIC listed in the year it was completed, or the applicant was already listed in the National Register of Health Service Providers or psychologists, or holds the CPQ like we mentioned above. Specialty also requires postdoctoral supervised practice and experience in the specialty. By its nature, the specialty of clinical health psychology denotes a level of practice requiring preparation beyond the doctoral requirements. Now, this can be met by the applicant applying for certification after one postdoctoral year if they completed at least 1 year of an APA CPA accredited clinical health psychology postdoctoral fellowship, or the applicant can apply for certification after 2 postdoctoral years when they've completed either a APA accredited postdoctoral fellowship in another area other than clinical health, if at least 50% of the training was in clinical health psychology, and they have 1 additional postdoctoral year in clinical health psychology experience. Or the applicant could have gone through a non-accredited but APIC listed clinical health psychology fellowship with 1 additional postdoctoral year in clinical health psychology experience. Or finally, the applicant could apply for certification after 3 postdoctoral years, including 1 year postdoctoral supervised experience in professional psychology and 2 additional years of postdoctoral experience in clinical health psychology. So I think what we're seeing here is that there are elements at 1 year, 2 years, and 3 years, depending upon how much clinical health psychology experience the individual has received during that time. In order to start the process, the applicant must complete the online application and attach their doctoral transcripts, internship certificate, and 2 endorsement letters. This, along with the application fee, begins the central review process. Now, there are some discounts offered to individuals listed here on this slide. Now, at this point, I'm going to hand off the presentation to Christina Shook, who will guide you through the next phase of the process.
All right, thank you very much. So phase 2, practice samples. Don't let them overwhelm you. This is the somewhat scary part that everyone talks about, but the good news is that it really isn't scary. It's a wonderful, wonderful experience. I personally really loved preparing my practice samples, and I think that with a little bit more information, you're going to find that this is really a wonderful exercise to prepare you for the board certification process. What you need to know is that there are 3 practice sample options for clinical health psychology board certification. There's the standard candidate option. There is the standard candidate option with a primary care focus. We'll talk a little bit more about what that means. And then last, there is a professional portfolio, which is called the Distinguished Senior Candidates option. However, it's important to note that this option is actually sunsetting in 2019. So for those of you that are new to this process, you won't even have to worry about this. It'll just be a matter of figuring out, do I want to go the standard candidate option or the primary care focus? And that's completely going to depend on what your current clinical practice is and where you see yourself as a clinical health psychologist and how you identify. Talk a little bit more about each type of practice sample option. The standard candidate, the most traditional version of this, is a candidate that's practicing clinical health psychology at a very specialized level of competency. And this candidate would be demonstrating biopsychosocial clinical applications of a broad range of psychological and allied clinical and research literature related to clinical health psychology. Good examples of this might be a psychologist that was working in an interdisciplinary pain clinic, a psychologist who might be working in bariatric surgery, someone working in neurology with headaches. So a very specialized level of clinical health psychology work. And you might be a clinical health psychologist working in multiple domains like that. But really, this is a setting that's focusing on the value and the good work that health psychologists are doing in these medical domains, really bringing to light the biopsychosocial model and how we apply our areas of expertise to those medical settings. In the standard candidate portfolio, candidates are going to submit just 2 practice samples. You'll choose from 2 of the 4 areas. Those 4 areas are assessment, intervention, consultation, and then management or administration. And it's key that you submit your practice sample in 2 different clinical categories or problem areas, and the practice samples should be no more than 2 years old. The heart of this practice sample is really a document that highlights your work and highlights your areas of expertise. And one of the really exciting and I think rewarding things about going through a practice sample is you realize it's a reminder of the theoretical bases of everything that you do and the empirical work that builds the foundation of the work that we're doing in these settings. And as you go through the process of the practice sample, you'll be highlighting your work and really sharing your rationale for why you do what you do in these settings and the literature that informs all of the decisions that you make, your theoretical approach to how you think about patients, how you treat patients, how you interact with patients, and also how you interact with and consult with your medical colleagues in these settings. And it's really an opportunity to highlight why you do what you do. And then also weaving into this an awareness of all of the relevant ethical questions that we ask ourselves while we're working in these settings, and also weaving in cultural variables and diversity issues that we often face in these settings. Your practice sample definitely needs to include all of the relevant characteristics of the problem. You'll share collateral information from your colleagues, from the providers that you work with in these settings. You'll be discussing any evaluation processes that you utilize, your protocols, your procedures, how you approach cases. You'll be sharing what your opinions were of the cases, any conclusions that you came to, any recommendations that you had for the patients, and also outcome. And then you'll be highlighting the relevant ethical and professional standards from our ethics and professional standards that we abide by every day in our practice. So you'll be highlighting the relevant ones in your work. Supplementary information is always needed with every practice sample. So basically, we want all the data, we want all the good stuff, and we want to see everything you did. So if you think about it as this is a deep dive into everything about this case. So we want to see
all of your original documentation. So things straight, if you use an electronic medical record, for instance, you would pull copies of your patient notes right from any reports that you did, any therapy notes, case notes, any referral notes that might be valuable in understanding what the presenting problem was. In particular, if it was a challenging case from a physician that was sending you a referral, you might want to highlight how you got the referral, how it came to you. You would include any type of testing data and all of your copies of informed consent and HIPAA documentation. And of course, all of this needs to be sanitized, and any protected health information should be removed from all of this documentation. So the next type of candidate that we want to highlight is someone with the primary care focus. And so instead of focusing on 2 comprehensive standard practice samples, here's the opportunity for someone in primary care to highlight their work in intervention, in consultation, and program development. So we would ask for 5 brief intervention cases, and we differentiate between a psychologist who might be practicing in integrated behavioral health who's doing traditional mental health, so depression, anxiety, PTSD. We want to differentiate between that person and someone who's truly doing clinical health psychology in primary care. So they're working with insomnia or chronic pain, they're working with diabetes or hypertension or congestive heart failure. So 4 of your cases should really be focused on clinical health psychology, and then 1, of course, can be traditional mental health. We would ask for 6 brief consultation cases. Again, really the focus here is on clinical health psychology consultation. So 4 of those must be clinical health psychology, and 2 of those can be more of your traditional mental health. And when you think about what's going to fall into the realm of consultation, be thinking about a curbside consultation, perhaps, with a primary care provider to discuss a patient and a complex case. You could think about just a one-time conjoint visit with a primary care provider where you're truly consulting on the case. So you're thinking about it that way. In terms of program development, we want to highlight any management or administrative duties that you have within primary care. So any development that you've done on clinical pathways for depression or alcohol or pain, any clinical practice guidelines that you are developing for your work in primary care, any disease management protocols or programs that you've developed. Maybe you're developing a shared medical appointment for diabetes and hypertension. Anything that you're personally developing and working on is really, really valuable for helping to highlight the important work that psychologists are doing in primary care, and also demonstrate your leadership skills. So if you're completing if you're completing practice samples in integrated primary care, again, you select 2 of the 3 categories from above, and you can actually do a 1 primary care focus and 1 standard practice sample. So that's an important clarification as well. So there's lots of flexibility in this. The Distinguished Senior Candidate, again, this is sunsetting in 2019, but it's important just to review. This option was available to anyone who was 15 or more years post-licensure, and it didn't require practice samples. It was just a professional portfolio, and the portfolio reflected a rich body of work that a psychologist who is advanced in their career might have. It demonstrated their advanced competencies and contribution to the clinical health psychology field, whether that's through publications, mentoring, editorships in journals, that kind of thing, or dedication to the community and programs that they might have built or trainings that they might have done. So the Board of Clinical Health Psychology, the Board of Directors, in July of this year did decide to sunset this and discontinue this option. We already reviewed what the option was. So the difference between the standard candidate and the senior candidate was that the standard candidate is required to submit practice samples. And the new policy in 2019 is that all candidates are going to be required to submit practice samples, whether they're primary care focused, whether they're standard candidates. And all of this is going to be explained in the new candidate manual that will come out and will be on the ABAP website. There is a grandparent clause for those of you who are already approved for candidacy and you're in the process of board certification. You'll still be eligible for this option permitting a professional portfolio as specified in the current manual. And so for any of you who were getting nervous, no need to worry. You'll still be grandparented in if you were already in the process and were approved. The rationale for changing this policy was that ABAP really wanted every specialty board to ensure that every candidate demonstrated their competencies in all of these domains. Assessment, intervention, and consultation and functional competencies are applicable to all of us, no matter where we are in our career. And it was just thought that the senior candidate option just wasn't rich enough to provide the ability to evaluate competencies. And so regardless of where you're at, we want you to be able to showcase your skills and the great work that you're doing. And 2 practice samples are just going to be required to be submitted no matter what at this point. So another common question is, what am I supposed to talk about in my professional statement? And I think this sometimes is especially nerve-wracking for early career psychologists, those of you who might be in fellowship right now or even internship thinking about clinical health psychology work. I know I was nervous about what the heck do I talk about in my professional statement, because I was starting this process while I was on fellowship and very early in my career. And so no need to worry. This professional statement is really a description of who you are, where you've been, where you are now, and where you want to go. And so it gives you 7 sections for opportunities to discuss this and to discuss your transition from psychologist to clinical health psychologist and where you want to be in the future. So you're going to talk about your current professional work. You're going to talk about everything you've learned in terms of the evidence of the science base and the application of what you do and why you do it. You'll go through all of the good work that you're doing in assessment, what you do in realms of intervention, what you are doing to consult with colleagues, administrators, and programs. And you'll also talk about any areas that you're working on developing programs. And you can also include research in here as well. You're going to talk about how you approach complex interactions with patients and with providers and colleagues and administrators. There's opportunity for you to highlight the individual and cultural diversity areas that impact the work that we do. And then you'll also be able to talk about challenging ethical dilemmas that you've encountered, how you navigated them, what ethical standards and codes were utilized, how you managed that case, what the outcomes were, and you'll just verify that you haven't had any ethical or legal complaints since candidacy. And on average, a professional statement might be anywhere in the range of 10 plus double-spaced pages. Practice sample submissions. So this portion, this phase 2, includes your practice samples, which we reviewed. It includes your professional statement. It will include your CV. And keep in mind that your CV and your professional statement are going to serve as the foundation for discussion in your oral examination. And so it's a really great opportunity to utilize your professional statement to talk about who you are. And one of the things that I really loved about going through the oral examination process, and I won't steal your thunder, Dr. Kearney, but I loved having the opportunity to talk about my development as a clinical health psychologist and all of the things that I was doing. And they really dug into my work and talked to me a lot about that during the oral exam. And so it's a really important document for you to take your time with and think about how you want to describe yourself and who you are as a clinical health psychologist. And then, of course, there's a $250 fee for the practice sample review and establishing the oral examination team. And before submitting your practice samples, please feel free to ask for a mentor. We have a fantastic mentorship program that is geared toward assisting you with your practice samples. And you're assigned a mentor typically. As often as we can, you'll get a mentor who's assigned to an area that you are actually working in. So if you're an IPC psychologist, you usually will get a mentor, if we can do it, who's an expert and has experience in IPC. And so we try to tailor those mentors to the areas that you work in as best we can. And if you request it, typically it's a good idea to have rough drafts at least available of professional samples and professional statements and practice samples. And the evaluation process is pretty simple. We review practice samples or the portfolio. You'll have your CV reviewed, your professional statement. That'll be reviewed by a minimum of 2 clinical health psychology board certified specialists, and there'll be 3 outcomes. Either you'll move forward and proceed to oral examination, so you have a pass. You will either be asked to revise your documents and resubmit them, and if you're asked to revise, you'll be given very specific feedback and comments about your practice samples, which will help support you in revising them and resubmitting them. And then you may also have the option outcome where you'll need to submit an entirely new practice sample. And the mentors are available to help you throughout that process as well.
Okay, thanks, Dr. Shook. I hope you can see my video okay.
Yes.
All right, great. Well, I'd like to kind of talk a little about, this is Lisa Kearney. Nice to see all of you and meet you. I'm going to talk a little bit about what to expect with the oral examination process and how to prepare. And it's not like going to the dentist like this poor dog. So next slide. All right, so typically oral exams are scheduled for 3 times a year at various parts around the country. I think that's one thing, is after you get through all of the practice samples and you've passed the review, yay, you're ready to go. Sometimes you've got to wait a little bit of time until there's an opening at an oral exam. So I just want to make sure that you are aware that sometimes there's a little bit of delay depending on how much those slots are filled up. There's a $450 examination fee, and this is based in the assessment center model. So you meet with a different examiner for each part of the oral exam, and I will walk you through this kind of 4-part process. I have found, and I'm kind of geeky, so I'll just admit that myself, I loved my oral exam, absolutely loved it. I know a lot of times working in the setting that I do in VA, I wasn't always surrounded by other health psychologists in my day-to-day work. And so to be in a place where you are around other people who love what you love and get what you do is very exciting. And so although it's always anxiety provoking when you're going into any type of testing process, I just want to let you know that it's actually a very warm process, welcoming, and great to have people around who are excited about what you are doing. So there's 4 different parts, and I'll just kind of walk through each one and kind of what to expect. So you have an ethical and legal issues section, and in this, you can expect to have a case given to you in which you're going to review some of the challenges that may exist in that particular scenario. You'll be asked to identify potential problems and go through that. I know I was very anxious about this section. I thought I had to go back and memorize all of the APA ethics number by number to be able to cite that. It's not like that. but it's very helpful for you to go back and review any of your health psychology texts related to ethics in practice. It's great to have case scenarios that you read through with partners that you're preparing and kind of analyze some of those different cases so you're prepared to talk through them. It's also helpful to go back and review your own practice samples and ethical situations or legal issues that may have come up in that, or in your professional statement, for example. People may ask you about that. They may also ask you about other ethical situations that you didn't talk about in your practice sample, or give examples and ask, is this something that you have experienced in your own practice? So just think a little bit about those lines to help prepare you with that. You do want to be familiar and be able to speak to your own setting. So I live in Texas. I work within the VA system. So there are specific regulations that I am bound by that maybe you aren't in Massachusetts or in a different organization. So being able to speak to that particular practice setting. Certainly if you're within the Department of Defense, you need to be able to cite those different regulations that may not be applicable to those outside the Department of Defense. The professional issues section is one that I found very enjoyable. That's where you're talking a little bit about your own day-to-day practice as a clinical health psychologist. So you'll be asked about projects that you've been developing, your research if you're doing new research, clinical training you might be involved in. You'll be asked about addressing diversity issues in your setting or ethical issues in your setting. It's just a day-to-day role of a clinical health psychologist. And also to look a little bit about how are you involved in the profession of clinical health psychology as a whole. Are you on a subcommittee of Division 38? Or are you somehow involved with Society for Behavioral Medicine? Are you giving back in some way to the profession as a whole? And are there professional issues, more broadly speaking, that we are struggling with in the field of clinical health psychology or within psychology? Are you aware of those, and what are your thoughts about those particular issues that are coming up? So that's less stressful in the sense of not having to cite different things, etc., but you need to be able to speak to these professional areas. The next is actually kind of looking at the practice samples that you submitted. And so be prepared to answer questions about why did you choose to do a particular intervention. Really important to be able to cite from the literature what guided you to have this particular approach with this particular patient. I found it very helpful to go back, and you will have already gotten to really know the literature in that area from writing up your practice sample, but to become familiar with the literature and be able to cite reasonings for why you did that. You may be asked about interprofessional experiences and helping that particular patient, etc. And then lastly, a standardized clinical case assessment. This is really, you'll be asked to pick from a couple of different scenarios and then be given some limited information, and you'll be kind of asking questions. You can bring in your own template that you might use in your clinic setting, a blank template that you might use for your functional assessment if you're in integrated primary care, or a standard assessment that you would use as a clinical health psychologist. And so you'll be asking information to get further information, and they'll ask you a little bit about case formulation. Why would you, particularly do particular interventions based on the literature, et cetera? What kind of diagnoses are you thinking based on the information that you obtain? So all of those four come together. There are cross-cutting competencies that really go across the modules. I think sometimes people think ethics is just in the ethics section. That's not the case. That's really across. You're addressing ethical issues in all of these different areas. Same with diversity issues, interpersonal interactions. You can see how this is woven in across the settings. So that's kind of where we are currently with doing oral examinations. Next slide covers kind of some of the different information that is coming up next. So in 2019, you'll notice that there are some more cross-cutting competencies. So your foundational competencies on the far left side of the screen, as well as additional functional competencies that you may, advocacy, teaching, supervision, those types of things. So there will be more to come with the new manual that's coming out, and just want to make you aware that these are expanding in the very near future. So upon passing the orals, the chair of the exam committee sends the results. There's a little bit of a delay. So it's not like when you go in, you take an exam and you know that you passed right away. Unfortunately, I know that's also anxiety provoking. But I'll tell you, it tends to be more timely than the 1 month even. Folks really try to work very hard, but they also want to give specific feedback for individuals who may not have passed as well. And so it takes time to develop those in a thoughtful way. At that point, you're directed, if you pass, that you can use that title of being board certified in clinical health psychology. If you're a Division 38 member, which I hope you are, you receive a little refund, which is always nice. You can go have a celebratory dinner. And then you are immediately confirmed membership in the academy as a fellow. The other nice bonus, which somehow I missed when I got this, is you get bonus 20 CEU credits, which is great. And you can put that on the next year for your licensure. And then there's a wonderful, wonderful ceremony put on at the APA convention, if you're able to go to that, celebrating all those who've been gotten ABEP status in the last year. Also want to speak to you beginning just a couple of years back, we moved as a board across ABEP to have maintenance of board certification. So once every 10 years, you would be going through a review process with that, and you also have an annual attestation statement that you're continuing to meet all of these different areas. With that process, there would be submission of materials, etc., but it's a truncated version of this longer approach. So there's more information on the website. We're still getting that up and running now, and so you'll hear more about that in years to come. So helpful tips and some summary points for you. Choosing the right case is very important, or the right cases. I love Jared Skillings, who was one of our former presidents of the Academy. He often shares about how he wanted to pick like his most complex case to do and kind of highlight his skills. And he ended up saying that was not the best way to go. Nor do you want to pick the easiest cases. So somewhere in between. So stay in your wheelhouse. You know, don't present a transplant case, if you've only done 5 of them, that's not the thing to do. Something you're comfortable in, it really represents your normal state of being, your normal practice. Pick cases that also can highlight your breadth of knowledge. It's kind of like being on The Voice. You want to be able to show your full range, not just the middle range. Otherwise, you get critiqued on that. So your full breadth of knowledge and experience. You do want to make sure that you emphasize diversity elements, how you've attended those, as well as legal issues. And one of the things as a mentor I've often noticed is people assume that the reviewer knows why they're doing what they're doing. So you need to assume that the reviewers don't have any knowledge of you, which typically they will not. They will never have met you. You need to cite why you did what you did and how that came from the literature, and explain the clinical decisions. So I know it may just think, well, every clinical health psychologist will know this, but we want to know, why do you know this? What's it based in? Reference, there's a reviewer's checklist in the candidate manual, so you can actually look at the checklist the reviewers utilize to assess you. That's very helpful to kind of identify, oh, am I meeting all of the different qualifications that are denoted here? So again, average practice sample length are 10 to 15 pages each. Some people have appendices, like if they've created protocols or something and they attach a protocol, those kinds of things. But if you're doing the integrated primary care route, notice that all together, it should still be about that equal length. We would expect each case to be briefer based to the brevity of the intervention. And last but not least, get a mentor. Christina talked about this a little bit earlier. Once you have drafts of your practice samples in your professional statement, you can reach out to me as the president of the Academy. I'm the person who helps assign mentors. We have people all who have loved going through this process and want to help other people going through this process. And what they will do is they'll meet with you virtually, read through your samples, give suggestions and tips. When you get ready for oral examination, they can kind of help prep you for that as well. If you have a revise and resubmit, they'll look at the reviewer's comments and how you've tried to address them. So just know all of that is there for you. You just need to reach out and explain on our website how to do that. So some summary points, again, realize, let me first of all just tell you, just do it. Just do it, just get started. I think I took 2 years just to turn in the application. I always regretted that because I was so stressed out about it. And it was silly. The application portion is the easiest portion. You have to be thoughtful about it, but it doesn't take 5 million hours to do. You can do this. You know, if that's one thing you come away from today is go do the application part. And then keep some accountability with getting your practice samples together, get mentoring. I like to partner with other people. So meeting with other people once a month at a coffee shop who are trying to go through this, you know, helps you keep that accountability, or having a virtual accountability partner. How are you doing on this? And check in regularly. You've got a year to turn in those practice samples after the candidacy, and then the oral examination. And then lastly, you've got the annual renewal and then the 10-year maintenance of certification review. The bottom line is get started with it. I'm going to turn back to Dr. Vogel. He's going to show you a little bit of another resource that's available to help you. And then we'll open this up for questions. So I'll look back at the chat box and see what I missed. So Mark, back to you.
Yeah, so one exciting possibility for just learning more about this is a Prezi that was designed by Dr. Megan Mead-Higgins. So she was a postdoc fellow in our program this past year, just graduated. And she came up with this really creative idea of how to create something that would be sort of a game board that would kind of go through all the steps, and is self-guided, so you can start anywhere, but you could go through the steps 1 through 9 that she has outlined there, and that she's kind of made it so it was easy to navigate, and that there was videos, and so I'm just going to do a bit of an introduction to it. We can't show the Prezi because of the way this webinar works. It wouldn't translate well, but we'll show you a link at the end where you can go through this if you like. So again, she's created this game board with all 9 steps that are involved there. You know, some of the steps being the references and things like that. But and with each step, she has kind of an organization. So for instance, here's the first step about the importance of board certification. And you can see the bubbles along the right are information. Then she has interviews. And then finally, some quiz questions that kind of test your knowledge. The videos are fun, so she introduces each of those sections herself and kind of gives you kind of tidbits and thinking like, hey, you can do this. So it's sort of motivational, but it's also informational. And then this would be an example of one of the informational slides, which talks about kind of trends towards board certification and actually has references in that you can look up and review. Then finally, there's different interviews. This is Rick Simey, who was nice enough to videotape himself. And we have other, she collected other videos in this. And that it is kind of put together so that you can get both personal stories, but also the steps involved. And then her quiz questions in each one, she would have the questions up there, and the way you advance to each one is you keep hitting the arrow key, and it would show you what was the correct answer to the quiz question. So one of the caveats we would need to give you is that this has not been updated to the current standards, and so some of the videos do talk about the senior option, and so we'll eventually have to edit some of that video and modify some of the text that we'll be doing later this year and early next year. But again, it is something you can go through now and look through and get some idea. There's 2 ways to kind of go through. You can see there's the long URL, or the short one, the bit.ly link that's there. It's bit.ly/ABAP_Prezi. And I really want to thank Dr. Mead-Higgins. I don't know if she's on today, but she did a fantastic job. She and her husband, who helped edit the videos. And so that represents a great resource. All right, so let's go to questions. And I do have, Lisa, do you want to talk about some of the additional resources?
Oh, sure. Happy to do that. And then maybe you can help answer this original. There's a question from David in here about if you don't have an APA internship, and then we'll open it up for questions. So additional resources, the American Academy of Clinical Health Psych website. I also put that in the chat box. That has, how to connect to a mentor. It connects over to some of our YouTube video tutorials. We've got Dr. Skillings, our former president, on there. And then, of course, the ABEP website has incredible resources. The other thing that you don't know is all of these people who are ABEP, who are on the boards, who are on the academies, they're doing this because they want to help other folks do this. I mean, they love helping people. Don't be afraid to reach out to any of us with questions, as well as our other board members or other folks here. Don't suffer in silence. Know there are other people here who've gone through this process and may be in the same unique situation as you are in. Let me see if we can, Mark.
So I have one question that Dr. Daniels posed to me.
Great.
She said that she's recently licensed, finished her degree and internship in 2014, completed the test, the hours, and licensure this year. She said, how do I apply this? How do I apply this to me? Too late to specialize or need to do 3 years postdoc hours to be able to qualify in order to submit her practice samples. So again, it sounds like if you completed your license, you at least have 1 year of postdoc experience, maybe 2015 or 16. And so then the question is, does that person need full 3 years? So I think the short answer would be yes. So 3 years postdoctoral, if you had not done a postdoc, formalized postdoc in clinical health, or a postdoc in either one of the other ones, which would allow you to get it done in 2 years. And so you've done neither of those. None of those have to be specific to clinical health, but you need to have sufficient 3 years experience. Any changes to that with our panel?
No, sorry, go ahead, Lisa.
No, you go ahead, Christina.
No, honestly, go ahead. I was going to respond to a different question, so.
Okay, no, that sounds exactly right. The other person you could reach out to is on the ABEP website, and I believe, oh gosh, I'm probably going to mess this up. I think it's Katie Kanzler, who's our current person who reviews candidacy applications as they move forward. You could also follow up with an email to her, but that's my understanding as well. Dr. Goody is on here. Oh, I just adore you. Dr. Goody, who is on the board as well, and one of our oral examiners just said, you are correct. Thank you for the affirmation, Dr. Goody.
Well, I actually unmuted him if you want to say anything, Jeff.
Oh, that's all I wanted to let you guys know. So yeah, so we're Katie would be somebody to run that through, but what you guys described is correct. I would just say that you'd want some supervised experience in clinical health psychology if if it was not a significant part of your internship or you did a postdoctoral fellowship. Then part of the expectation is that during those 3 years that you've had some sort of supervised experience doing clinical health.
Great.
You can mute me again, Mark.
We like you unmuted, Dr. Goody.
Then the other question that was posed to Lisa, this is from David, who joined late, about if you didn't do a APA internship, can you still apply if you have CPQ? And we did address that, and so that would be again one other way to be able to qualify. So I just encourage David to go back and look at those slides. They'll be available on the website.
There's also a question about the oral exam, whether or not it needed to happen live and face-to-face. And so, historically, it's always been done face-to-face, my understanding.
Yep, there's no option to opt out of that. It's a requirement for you to fly in. It's typically in one of a few cities. Sometimes they do it here in San Antonio. Sometimes it's been in Denver and other locations, Minneapolis. So it depends on where they are, but you fly to that location.
I had a couple private questions. If I think they would be helpful for the whole group if you both don't mind me sharing.
Great.
Okay. So I was asked just about the standard practice sample submissions and the extensiveness of the references. You know, how many citations really do I need to support what I'm doing? And my reaction to that, and of course the rest of the board should weigh in, but the panel, I think it depends is really the answer. I've seen people have maybe 10, and I've seen people have 50. And I think it just depends on what you're talking about. I think the most important thing to do is to make sure that you have empirical evidence for the why behind what you're doing. So what is your theoretical approach? How do you approach cases, and what empirical support do you have for why you do what you do? And so if you use certain protocols, if you use certain articles, if you like to reference a certain type of protocol or procedure in your treatment approach, it's really important to cite what you're doing. And I think there are just some seminal clinical health psychology papers that we all reference that guide our work. And it's important to know those seminal papers and to be able to reference those and say, well, here's why I do what I do, and here's how my work applies to the biopsychosocial model. And that's my reaction to that. I don't know what the other two of you think about that.
Yeah, I would concur.
I agree, Christina.
And then someone else mentioned that it felt a little anxiety provoking but exciting to do the practice samples and the professional statement. And I just wanted to say, yes, I mean, it is a little anxiety provoking, but I think more than anything, it's exciting. And it's such an opportunity for you to think about who you are now and who you want to be, and to talk about the trajectory of your career and also where you want it to go, especially if you're an early career psychologist.
And then I have a couple other additional questions that I saw on the line. And one was about really the portfolio. And I think we want to really be clear on when that's sunsetting. I think we said in 2019, but I think that's like maybe January of 19. The idea is that for most people, unless you're already in the process, that's not going to be an option.
Mm-hmm.
Correct? We'll agree on that?
Yes. We are waiting for the final, it has not been finalized and uploaded on the website, but I imagine it will be early in the year.
All right. And then someone also asked, want to clarify there is no multiple choice written exam, and that is correct. It's just the oral exam. And
Yay!
Yay. Anybody who just doesn't like answering, those kind of questions.
I've got another one, Mark, while you're looking. Dr. Goody just sent me a note, and this is a great point, Jeff. I'm really glad you made it. You are told who you're going to have your oral examination with. So, list out your 4 examiners. So it's helpful to research a little bit so you know kind of what areas they're coming from, if they're similar to yourself or something different. It's also easier to have conversations and also be a little bit less stressed out. I'll tell you though, when I looked at mine, Jeff, and you were probably much more advanced than I was like, oh my gosh, these are the gods and goddesses of health psychology. So I was super excited, but I had a little bit of that being a fan experience. So that can happen too. But realize they got to put their pants on one leg at a time, just like everybody else. That's what my daddy always tells me.
I felt the same way too when I looked at the list.
Okay, I'm not alone. Thank you, Christina.
No, I felt the same way. But like you do for any good interview, you do your homework. I think that's just a good life lesson. So do your homework and you prepare, and you'll be just fine.
There's a couple other questions. One of the issues that I think has come up that people are a little confused about is the 1-year versus 3-year eligibility. And so maybe it would be helpful just to go back to that slide real quickly, because one of the issues is so that if you had your postdoc was in clinical health psychology, then it's basically just completing that makes you eligible. If you completed another APA or CPA accredited fellowship in an area other than clinical health psychology, which had at least 50% CHP training, then you could have one more additional year of training. If your postdoc was not accredited, then you would still have that plus 1 year of training. But if you didn't complete any formalized postdoc, then you would need a full 3 years of training before you would qualify. So the 1 year supervised plus 2 additional years. So I think some people were saying, what counts in that year. I think someone also said that their postdoc was heavy research based, and then they, kind of with only 20% clinical time, would that count during the time? So again, the idea is that if your postdoc really had less than 50% clinical training, you would need the 3 years really of CHP experience in order to qualify.
So I'm noticing we're getting to the top of the hour here. I want to thank Dr. Vogel and Dr. Shook for sharing all of their expertise and own experiences through the process as they got board certified. Dr. Goody to also being on. And I just want to welcome you all. Contact us. Let us know how we can be of help to you. We're going to continue as the Academy to work on additional resources to support you through this process. So email us. Reach out. We want to be here for you. Our email is on the last slide, and I also put in the chat box how to get these slides as well. So thanks everyone for being on. Have a great rest of the week.
Bye.
Thank you.